Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, HHS to overhaul childhood vaccine schedule to recommend fewer shots. The Department of Health and Human Services is preparing to announce an overhaul of the recommended childhood immunization schedule, aligning it more closely with the schedules of developed countries such as Denmark. The new schedule is expected to have fewer shots for children compared to the current U.S. schedule, which recommends vaccination against 17 diseases. However, there are significant differences between the U.S. and Danish populations, disease rates, and healthcare systems that call into question the appropriateness of directly aligning the U.S. schedule with Denmark's. For example, the U.S. recommends vaccination against respiratory syncytial virus, RSV, which is the leading cause of infant hospitalization, while Denmark does not. The U.S. also has a much larger population and faces a different mix of infectious disease risks compared to Denmark. The CDC recently stopped recommending that all newborns be vaccinated against hepatitis B within 24 hours after birth, following a recommendation by an advisory committee appointed by Robert F. Kennedy, Jr. The advisory committee has also voted to limit access to COVID-19 vaccines and to stop recommending the combined measles, mumps, rubella and chickenpox vaccine until children are at least 4 years old. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.